Hello and welcome. If you are working in my child care center or another child care center, you are definitely in the right place. My name is Amy Jolly and I am a nurse. I've been a nurse for over 20 years. And today we were going to talk about preventing and controlling the spread of disease. Now, I'm not going to make you look at my face the whole time. I'm actually going to turn off my camera so we can focus on the slides, but I wanted at least to introduce myself before we begin. So with that being said, I'm going to turn off my camera here. And this topic actually is something that is super easy to learn about, but it's truly harder to execute consistently and correctly. And that's the key. Not only will this training fulfill your training hours, my goal is to increase your understanding of some of the what and the why so you can gain confidence and insight, and so you can care for these precious kiddos as well as you possibly can. The resource I am using for the training, whoops, we gotta go back a slide. Here we go, is the minimum standards for child care centers in the state of Texas. Here's the specific chapter we're going to talk about, and I am using the December 2020 update. So depending on the date that you are watching this video, at least you understand when I received the information from. This training is intended for educational purposes only. Please do consult your facility's specific policies as they may differ than I'm training. Your administration team is also a good resource, and or your licensing representative for further guidance or clarification. The first thing we're going to talk about is hand washing. It sounds pretty boring, right? We talk about hand washing a lot, and we do it every day. So this shouldn't be something we have to talk about. However, I am here to show you that those thoughts might be wrong. There was a recent study done by the USDA, and they used a food preparation activity in where the participants in the study were actually, they had volunteered to participate in, they knew it was a USDA study, and they knew that they were doing a food preparation activity. They didn't necessarily know that it was, they were being monitored for hand washing specifically, but they did know that they were being monitored for their food washing activity. So I have a question for you. What percent of the participants do you think actually washed their hands when they needed to? There were over 1,000 participants. So this question is just who washed their hands when they needed to? Only 33%. And again, they knew they were doing a food safety study with the USDA. Okay, so of those 33% of people who washed their hands, and these are adults, mind you, of those who attempted hand washing, how many of them do you think, what percentage actually washed their hands correctly? Any ideas? 2%. So that's 2% of the 33%, not 2% of the total, which means it's less than 1% of the total. That's kind of gross, right? And this is adults who are knowingly participating in a study with the USDA on food preparation. So this, my friends, is why we are going to talk specifically about hand washing. Now, I do understand that there's a lot of words on this slide. Excuse me, but there's a reason for that. All of these are specifically listed in the minimum standards. Excuse me. Why do you think that is? Every single one of these on this list is important for truly protecting you, your coworkers, and the children in your child care center just by simply washing your hands. When you arrive at the child care center every day, anytime you're outside, before eating or handling food or medication, before feeding a child, handling raw food products or any food products, after eating, drinking, or smoking, after diapering a child or assisting with them with toileting, after personal toileting, handling or cleaning body fluids after removing gloves, and after using any cleaners or toxic chemicals. And again, every single one of these makes a difference in how healthy you can help these children and yourselves and your coworkers in your facility stay. So, when must children wash their hands? Now, these are all of the times that are listed specifically, again, in the minimum standards. It's a very effective practice which helps eliminate the transmission of germs. This is the number one thing you can do to help prevent the spread of germs by washing your hands and also washing the hands of the children. Now, again, upon arrival to the child care center, before they eat, after they play in a water table, and currently there aren't any water or sand tables being played in right now. This is being recorded during the COVID pandemic, but if these are specifically listed in the minimum standards. So I wanted to make sure you were aware of those too. But and in addition to those is after toileting or having their diaper changed. So if you are changing the diaper of an infant, you need to wash their hands too. You can wash it with soapy water on a paper towel and then get another paper towel of just water. And the reason is a lot of times kiddos, their hands are all over the place when you're changing their diaper. So the likelihood of their hands getting dirty as well is a little bit high. So it's a good practice. Anytime you do outdoor activities with the children, after feeding or touching any kind of animal, and anytime that you would have any reason to believe that the child has come in contact with any sort of harmful substance, the right answer is always washing their hands. I remember when I was in nursing school, over 20 years ago now, so it's been a while, but I always remember whenever hand washing was an answer on an exam, that was always the right answer. So whenever hand washing, you think it might be a good idea, it's always the right answer. Okay, this seems pretty basic, right? How do we wash our hands? First, we get them wet with water. Then we use soap. We scrub them. We rinse them and we dry them. So water, soap, scrub, water, towel. But why is this so hard? Why do less than 1% of adults wash their hands correctly? Well, where do you think most people get this wrong? If you had to pick one of these 5 steps, what do you think the number one step is that most adults don't do correctly? It's the scrub. So you are supposed to scrub your hands with the soap on them for at least 20 seconds and make sure you get all of the areas. When I teach my students to wash their hands, we talk about washing the tops of their hands, the bottoms of their hands, and in between their fingers. Don't forget your thumbkins and don't forget your wrists. And once you go through all of those, and if you're a lady, or a man, I like to scrub my fingernails on my palm too, just to get the soap up under my fingernails. By the time you do all that, that truly is 20 seconds. But this is the number one place that most people aren't being effective when they wash their hands. If you don't wash your hands with soap and scrub for 20 seconds, you truly aren't removing and killing all of the germs that are on there. So if you had to guess the second step, so the number one step that most people do incorrectly is scrubbing. What would the number 2 step that most people do incorrectly would be? Believe it or not, it's actually using water. So the first thing people usually do wrong is they don't scrub long enough. The second thing that people usually do wrong is they don't even do it with water. They'll just put soap on their hands without water first and scrub and rinse and dry. The reason you need the water is because it helps distribute the soap more evenly and effectively over the surfaces of your hands, and it helps it get under your nails and in the crevices, of your palms and all of those little areas that those little germs like to hide. So, again, water, soap, scrub, water, towel. So again, 5 steps. Most adults are getting it wrong. We can effectively model this for the children in our child care centers too, and teach them how to do it right from the beginning, and hopefully maybe make a generational change, or at least with the kiddos that are in our care, we can have a profound impact. There's currently a debate about whether or not you need to turn off the faucet with a paper towel as of the time of this recording, according to the CDC literature. So just know that that is something that is being discussed, and whether or not there's enough evidence for it or against it. I was always taught to turn off the faucet with a dry paper towel. So that is the practice I use. But again, I don't have specific evidence that I can share with you, and currently that is being discussed. So hand sanitizer. Hand sanitizer is really convenient. There are times, though, and kind of circumstances around when hand sanitizer is appropriate and when it's effective. So children must be 24 months or older for them to use hand sanitizer in a child care setting. So just remember that it's not safe for someone under 24 months to use hand sanitizer. My guess is it might be because they move their hands around so much, they have a little bit less control. They could easily rub it in their eyes or put it in their mouth. Hand sanitizer can be pretty dangerous for children, especially ones younger than 2. It doesn't take a whole lot of hand sanitizer. And again, we're using a product that is 60% or more of alcohol for them to have issues with alcohol. If they have hand sanitizer on their hand, there have been instances of a child just licking it and having issues with alcohol poisoning. So if that ever happens, you do need to call child poison control. So again, we need to supervise all use of children using hand sanitizer, and under no circumstances in a child care setting should a child under 24 months be using hand sanitizer. Now, the reason that we can't always use hand sanitizer is it's not a good substitute for hand washing when you have dirt on your hands. Hand sanitizer kills the germs, but it doesn't take the dirt off. So if your hands are visibly soiled for any reason, that's one reason where hand washing is definitely more appropriate than hand sanitizer, as hand sanitizer isn't appropriate in that scenario at all. Another place is after toileting or diapering. So after you go to the bathroom, or after you help a student go to the bathroom or change their diaper, hand sanitizer is not a good option. The reason is there are some gastrointestinal germs that aren't killed by hand sanitizer. There are a couple that you could have hand sanitizer on your hands for even 5 and 10 minutes of your hands being wet with hand sanitizer. And there are certain, GI bugs. So the ones, vomiting and diarrhea, that wouldn't be killed by the hand sanitizer. So always, when it has to do with toileting or diapering, for you or the child, you want to use soap and water for sure. And then the last time that hand sanitizer is not appropriate is anytime you are using gloves for anything and you take off your gloves. You always want to use soap and water, because there could be an example would be you have a small micro tear in your glove and you don't know it. So when you remove that glove, there could be something physically on your hands, and you would want to certainly wash that off right away. Hand sanitizer, again, kills germs. And for the most part, it's a good alternative when you don't have soap and water, or, you are just walking around, or before you eat, you can use hand sanitizer to kill the germs on your hands. But there are these times that I wanted you definitely to be aware of where hand sanitizer is not effective and definitely not recommended. So let's talk a little bit about gloves. I have listed here the times when it's appropriate in the child care center to use gloves. We use non-latex gloves in our child care center. Depending on where you work or what your facility's procedures are, you might use latex gloves. We typically use vinyl or nitrile. So that's what my staff is more familiar with. So anytime you are going to come in contact with any blood or body fluids, you definitely want to have gloves on. And you want gloves on 2 hands, not just 1 hand. Something I have seen as well is when you're putting your gloves on, if your hands are still wet, or if you pull it on really fast, if you rip the glove at all, that glove is no longer protecting you. You need to discard that one. You need 2 intact gloves on your hands to protect you. So you have your 2 gloves on your hands and they're both intact. You are doing whatever you need to do with the blood or body fluids or, with the cleaner that you're using. And then to take off your gloves, you don't want to touch the outside of your gloves with the clean hand. So you have 2 hands with gloves on. You would grab the outside of one glove and pull it off, and you would wad it up in the other gloved hand. Now, the hand that the glove was removed from, I don't want to touch the outside of the dirty glove with my bare hand. So what I would do with my bare hand is slide a finger up and under the glove and pull it forward over the other glove. So now I have a nice, neat little container, 2 gloves kind of wrapped in on themselves that I can discard. And then again, always wash your hands with soap and water after removing the gloves and disposing of them. If your gloves have blood on them in the child care center, they need to be wrapped up. In our child care center, we can wrap them up in like a separate bag and tie it off, or, to discard separately. But you don't ever want to throw those in the trash in your room, in your child care room, in your child care center. So we're going to go in a little bit different direction. So these would be the reasons that kiddos would be excluded from your child care center. And this is just a few of them. Again, you're going to want to talk to your specific facility and also look at your child care center guidelines. The state of Texas, kind of dictates our guidelines. And then also right now, we have the COVID-19 pandemic going on that I mentioned earlier. So some things have changed a little bit, and I'll get to that in a second. But so these are some reasons that kids wouldn't be able to come to school, or if they were at school, they would be sent home from your center. If they had diarrhea, and the specific wording in the minimum standards is, 2 or more, if they leak out of their diaper, or, more than 2 BMs, more than they would typically have in a day. So if this child, Susie Q, normally has 2 bowel movements in a day, and today she has 4, that's 2 more than her normal 2, then she would be sent home as well. Any kind of vomiting or fever. Now, fever here gets a little bit convoluted. If their temperature is 100 degrees Fahrenheit, and if you're measuring it tympanically, which is the thermometer that goes in their ear, or axillary, which is the thermometer that goes under their arm, we use a threshold of 100 degrees according to the minimum standards. If you take the temperature orally, if they're big enough to do that, because they have to lay it under their tongue, the threshold by the minimum standards is 101 degrees. But now, with the COVID pandemic going on, the CDC has put out 100.4 as the threshold for a fever. So again, check with your facility, check with your administrator, and see what you guys are using. But at our center, we are using 100.4 like the CDC says currently. If a child is exposed to a communicable disease like COVID, then they also need to stay home and quarantine. Or if they have any communicable disease, and those run the gamut from chickenpox or scarlet fever, strep throat, anything like that, or COVID, they obviously need to stay home. Or if they have an out-of-date immunization record, those have to be current and up-to-date. And depending on your center's rules and regulations will determine whether or not you also allow exemptions for reasons of conscious or conscious exemptions. There can also be medical exemptions, but again, talk to your facilities manager about whether or not that is something that you guys, first of all, allow and how you manage that. One thing that has become more popular during this COVID pandemic is the infrared thermometers. And these are the ones that you see people use that don't actually touch your skin. So it's held about an inch in front of your forehead. You pull the trigger on it and hold it about an inch away for a few seconds and you'll get the temperature. These are some of the things I've noticed. This specifically is not listed in the minimum standards of childcare, of childcare centers, but I wanted you to have a little bit of data. So if your center does use this, or if you are doing screenings, again, during the COVID pandemic, these are some things that we have found that have been an issue and some problem areas we have identified and some solutions we have that go along with it. So the first thing we've noticed is when we are screening kids in the car before they even get out of the car, if they have heat blowing or if they have air conditioning blowing on the child's face, obviously that can affect the child's temperature, not because the thermometer isn't accurate, but it's because there is that inch of space with airflow flowing in between that can affect how the thermometer reads the temperature. So what we have found is helpful is talk to the parents about not having the air blowing directly on the child, or if the child has a higher temperature and you can physically feel the heat blowing on that child, you can certainly give them a few minutes, have the heat not blow directly on them and take the temperature a few minutes later. And typically for us, it has come down to normal. The other thing we have noticed is some of the infrared thermometers are made to take temperatures two different ways. Let me explain. The first way they can take a temperature is a surface temperature. Some people have used infrared thermometers for a while when you want to check the temperature of a bottle, because you don't want to give a bottle to an infant that's too hot. So they would heat up the bottle, and then there's a setting on some of them, or a mode, where you're checking the surface temperature. So check your infrared thermometer. If the temperature seems excessively low, we have noticed the ones with the mode button that can switch back and forth between the surface temperature and the body temperature. Check the mode. If it's checking incorrectly, all it is doing is checking the very surface temperature of the forehead where you're scanning, not necessarily the internal body temperature on that artery right there. So check the mode. And then if you are trying to check a surface temperature and you have it set on a body temperature, again, it gets messed up. Not all thermometers do that, but that is something we have kind of worked through. The third way we have noticed with the infrared thermometers, because we have done screenings outside, so the outside temperature or the ambient temperature, all thermometers have a temperature range of where they are considered or have been studied to be effective, which means essentially they work in this temperature range. Well, if it's 40 degrees outside and the temperature range of your thermometer is between, let's say 70 degrees and 90 degrees outside. So not the temperature of the person, but the temperature either in the room or outside, wherever you are taking that temperature. If the sensor on that thermometer gets that cold, it's not going to be accurate. So you have to be mindful of where you're using these thermometers. And again, up until recently, this hasn't been an issue because people weren't really using this kind of thermometer that much. But with the pandemic going on and some screenings going on in certain places, these have definitely become more popular because people could get them. So be mindful of these three areas if you are using these thermometers in your facility or even at home. So to review, what we have gone over in this training is we've talked about hand washing, who needs to wash their hands, when, and how. Remember the how, right? We want to do it right. We want to do it for long enough. We want to use soap and water and dry it. And whether you turn off the faucet with your paper towel or not, is up to you, or maybe your facility has a policy on that. But effective hand washing is the number one way and the absolute best way you can protect yourself and the children in your care and your family at home. Hand washing is, when done correctly, is really incredibly effective, not infective, it's effective. So hand sanitizer, we also talked about that. Who can use it, who's old enough to use it, when it's appropriate, really when it's not, and how to use. I did not talk about how to use it, so let me touch on that quickly. When you're using hand sanitizer, again, 60% alcohol or above. You put enough on your hands and you rub it in. Same with your same as if you're washing your hands. You rub the hand sanitizer in tops and bottoms and in between your fingers. I get a little bit under my nails. Don't forget your thumbkins, and then a little bit around your wrist. Some specific hand sanitizer bottles do have directions or how much you're supposed to use. Some will say 2 pumps. Some will say, until the surface is fully wet. So sometimes just check your labels. But just make sure you are using enough and it's not like a quarter of a squirt that barely covers both palms. That certainly isn't killing very many germs on your hands. So make sure you're using that correctly as well. We also talked a little bit about blood and body fluids. This is a way that disease can be transmitted and also prevented, especially when you're using gloves and some of the other practices of hand washing that we talked about. Illness, we touched on very briefly, just because we are talking about communicable diseases. All communicable means is it can be given from one person to another. And then I did touch on the infrared thermometry. I really appreciate your time. It has been my absolute pleasure to train you today. Remember, please consult your facility's specific policies. You could talk to your administration team and or your licensing representative if you have any questions for further guidance or clarification or what you might do differently. This was just to help educate you, give you, some training hours, help you understand maybe a little bit more about why we do what we do in training like this and why we continually talk about hand washing, because truly most people aren't doing it correctly. So I hope this was helpful, and I wish you all a wonderful day. Be well.